is nice to see you today. My name is Lee and I'm the medical assistant that'll be checking you in, taking your vital signs, and just confirming what brought you in today. How are you doing? Good, good. All right. So you came right on time. If you could confirm your first and last name. Perfect. And any changes to your primary address at all? Nope. Primary phone number ending in 321. Perfect. Any changes to insurance? Awesome. And the pharmacy we have, the CVS on Fort. You want to change that one? Oh yeah. Do you know what city that's in? Yeah, I found it. All right, and it looks like for the appointment type, you're here for your annual, but also a preconception appointment. Well, that's very exciting. Do you have any other kids at all? First time trying? Even more exciting. What a beautiful process to start. Absolutely. All right. And have you just started? Have you been trying to conceive for a few months or years? This is the first month. Beautiful, awesome. Oh yeah, Leah and the PA will be super excited to hear about that. She's actually starting that process too. Yeah, so she can kind of share a little bit about the steps she started taking as well. It is so good that you came in for this type of appointment. I feel like it's something that's not talked about enough, and so many patients don't even know that this is an appointment type, an appointment reason to come see your OBGYN. So that's fantastic. Awesome. All right. Now, I did just want to confirm that you know the hospital that we'll be delivering at. Yeah. And regarding group coverage, there is a possibility for a male provider. Is that something that you're comfortable with? Okay. I always like to start off with those things because these, things could be deal breakers for people. And it's always good to get established in an office where you're comfortable with the OB coverage as well as comfortable with the hospital that they work out of. So you're already a step ahead. All right. Just to confirm as far as medical conditions. Okay. Any change to your med history? All right. And have you seen your primary care doctor recently for routine screening and, diabetic checkups, blood pressure? You have an appointment coming up. Awesome. Last dental visit as far as your dental care? Good. Okay. All right, excellent. And same relationship, no longer using protection as you're trying to conceive. And you are due for your pap smear. So Leah and the PA will probably be doing your pap smear today. STI screening is always a great idea right before you try to get pregnant, so we'll do that for you. Basically, you'll be all up to date for the year. Awesome, that's so exciting. Okay, so I'm gonna get your vital signs like I normally do, and then Lena the PA will do your annual exam and pap smear, and then she'll get you started on the necessities as far as starting your preconception journey. Yes, we'll definitely have some paperwork to give you. It's kind of like little patient education forms. All right, I will wrap this around that one here. This is so exciting. I'm so excited for you, and I'm sending you all a baby test. Very good. All right. Blood pressure is normal, so we're off to a good start. We'll do a temperature checkup, and then I will probably give you a cup just to leave a urine sample. We'll get some infection testing off of that. All right. What was that? Oh, yeah, no, we can just do a pelvic and pap today if you want. For sure, yeah, no problem. All right. Yeah, that's okay. If there's any parts of the exam that you just weren't anticipating or you're feeling, we don't have to do the breast exam today at all, but you're doing your self-breast exams. Gotcha. All right, right underneath the tongue. I'll let Lana the PA know. Alright. Temperature is good. Alright, let me write those things down in your chart here. I'm losing the pencil. You see that? Embarrassing. Alright. Alright, very good. So, what I'm going to do is let me grab a cup here. Put your name on it. Just put your initials. Okay, cup. I'll leave this for you on the counter. There will be a drape there for you to get undressed waist down. We'll defer the breast exam today, no big deal. We'll do pelvic exam, pap smear. Lena, the PA, will kind of talk about things to know during the preconception time. And then we even have samples as far as ovulation strips and prenatals, so we'll get those to you as well. Absolutely my pleasure. Congratulations again on beginning this journey. Lena, the PA, will be in. You'll just want to get undressed, waist down. You'll take that drape, lay it over yourself, and then you'll be good to go. Awesome. All right. I'm so excited for you. All right. So I heard that we were going to start our preconception journey. I am so excited for you. Did leave the medical assistant tell you I was kind of along that same process? Yeah, but just future planning. You never know when it could happen, right? So today we're doing your pelvic exam and pap smear, basically making sure you're all up to date on routine cancer screenings, infection screenings, and then we'll set you up so that you're good to start on your journey. Awesome. Yes. So let's get this going for you here. Let's get the examination part over with, and then we'll kind of talk about everything else. We'll kind of go through a little checklist. Exactly. I'm just going to move this a little bit here. We're going to start by looking outside first, okay? Thank you. Just going to lift this a little bit. Again, just making sure we don't see any suspicious moles or lesions. Okay, outside anatomy looks completely normal. Let me grab some lubricant here. We're not having any vaginal concerns today, right? Good. Okay. You're going to feel some colder pressure. There you go. Doing okay? Good. All right. Cervix is well visualized. sorry. Weirdest sound ever. Let's see. Your pap smears up here. Okay, gonna go in with our brushes. First one here. Okay. Second one, the spatula. Okay. Just gonna kind of mix those a little bit. We will be sure to send this out to the lab. Let me take a speculum out for you. Everything looks super healthy today. No abnormal discharge, odor, itch, none of that, right? Good, good, good. Last part here is going to be an internal exam with my gloves. So I'll put some more lubricant. Alright, you're going to feel a little bit of pressure. Any pain? Good. No enlargements or masses. And no pain when I press you here. Alright, I'm going to cover you up there. We'll take these off. You did very good for your pelvic exam and pap smear, so you're all set from that end. Let me put some sanitizer on and we're going to talk about things to sort of know about your preconception time. Sounds good? Awesome. Alright, let me just get you all situated and covered. There you go. So, I put it off for you basically like a pre-pregnancy care checklist. And so really the big ones for us are to identify how your current medical status is. And by the way, everything I talk about today applies to your partner as well. So it's always good to kind of take care of, you know, both the partner and the patient. So really, we want to talk about diet and lifestyle, making sure that if you have underlying medical conditions like diabetes or high blood pressure, that these are things that are taken care of prior to getting pregnant. It's always a good idea as well that if you're on any medications right now from other providers that are prescribing them, to make sure that you communicate with your provider if you plan on trying to conceive so that they can make sure that you're on a medication that's safe to use while you're still pregnant. And if not, how to adjust that in the event that you do become pregnant. Does that make sense? Awesome. Now, are you taking any supplements at all right now? Okay, and are you taking any prenatals? Not yet. No problem. We've got some samples for you. Now, you've never been pregnant before, no history of miscarriages or ectopic pregnancies? Okay, just want to confirm that. I heard that you already have an appointment with your dentist as well as your primary care. Both of those things are great to get evaluated before you get pregnant, just to make sure that your oral care and your physical well-being is good. Do you exercise at all? Excellent. Yeah, I think they recommend like 30 minutes, 5 days a week as far as exercising. Let's see, you don't smoke any cigarettes, marijuana, nothing like that? Okay, and then you of course feel safe in your current relationship. Okay, very good. Let's see, you are an overall very healthy person, so I'm not too concerned. One of the things that we'll definitely want you to get started on though is a prenatal. One thing I tell all of my patients is there isn't necessarily a perfect prenatal vitamin out there. It's just a matter of finding the one that works best for you and that makes you feel healthiest, makes you feel your happiest. I know there are some prenatals that make some patients feel sick, whereas others don't. The goal, though, is to make sure that you understand what nutrients and vitamins you should be having when you're pregnant, and you can pick your prenatal based off of those things. So over here, I printed you off a form. It's called Nutrition During Pregnancy. The source I really recommend is called ACOG, or the American Academy of Obstetrics and Gynecology. And they have a whole section here that actually explains every component that should be in your prenatal vitamin. Now, each prenatal is going to either lack or be deficient in certain things, and that's okay. They'll also explain to you food sources that you can use to supplement with the prenatal. Which one I'm taking? A lot of people will ask, and let me again preface this, that I don't think the one that I'm taking is necessarily the best one. It's just the one that I prefer and that works well for me. So my prenatal that I take, I'm going to give you samples on. It is the 1-a-day prenatal advanced with brain support, and it also comes with a choline supplement. One thing I like about this is it's 1 tablet a day versus other prenatals that may be 4 or even 5. It has everything you need as far as vitamins and nutrients. It's just some of the things they give less of than you would need, and again, you would know, and then supplement. It comes with an additional choline supplement, which a lot of prenatals completely lack, and it's cheap, affordable. I get it off of Amazon. And I will be sure to put it in my storefront in the link in my bio in case you want these. So yeah, this is basically the size of them. They were quite intimidating to me, I'm not gonna lie, but they're pretty easy to swallow in my opinion. And you'll start taking that now. It's always good to get started on prenatals before you get pregnant. Brain fart. Hashtag not sponsored, by the way, but I'm here. Anyway, moving on. So you're gonna take your prenatal every single day, right? And then there are some people, especially people who really want to try and get pregnant quickly, that will do ovulation testing. This is actually something that I started doing because I recently got off of a birth control pill. And so when I ovulate was kind of a big question mark for me. So I'm also going to give you some of these. These are the easy at-home ovulation test strips. Get them off Amazon. Again, it's a convenience factor for me. And then you'll open it. It'll come with 20 pregnancy tests and 50 luteinizing hormone tests. And it's those ovulation tests that are in blue that will help you track when you're most likely going to release the egg and ovulate. And so they come with their own app. It's like very easy to understand. You just follow the directions. Keep in mind, I've never been pregnant before either, so I'm just going for simple, easy, and effective. Yes, so I am going to give you this box here. I will give you these prenatals for you to take, so I'll put that over on the counter for you here. Other than that, getting started on a prenatal, seeing your primary care, making sure you are the best version of you, both mentally and physically, is really the best way to start your preconception journey. Of course, through ACOG's site, you can check skincare, hair care to see if there are any other adjustments you may want to make now before you get pregnant. But with all of that being said, thank you so much for coming in today. I'm so glad we had this discussion because a lot of people don't know that there is a preparation as far as, when trying to get pregnant. So I wish you the best of luck. I'm sending you all the baby dust, and I will hopefully see you next time when you come back with a positive pregnancy test. Absolutely, absolutely. Well, I will see you later.